Hi everybody, my name is Joseph Anthony Jerez. I'm from New York City in America. I am a patient. I'm over here at Swiss Medica, which is a stem cell clinic in Moscow, Russia. I'm here to do a Q&A session with Dr. Alexandra, who is an anesthesiologist, but her specialty here in the clinic is regenerative medicine. So Dr. Alexandra, first off, what are stem cells?
The stem cells are special cells in our body which each person actually has, and their basic function is to activate regenerative capacity of the body. They work all the time, but when we have any kind of chronic problems or any kind of acute damage, they are among we can say the first and the last who are controlling regenerative process and repairing.
Okay, so basically they're repairing the damaged cells in your body.
Yeah.
Okay, that's great. That's very informative. Now, when I first came here, now I'm a patient of Swiss Medica. This is actually my 5th visit. I came here for multiple illnesses, high blood pressure, type 2 diabetes, chronic kidney disease. Now, when I first came, I was given umbilical cord stem cells. Now, you want to elaborate a little more on the umbilical cord stem cells?
Yeah, so these are cells taken from a donor, and when a patient...
From a healthy donor?
Sure. All types, all therapeutic dose of stem cells, which is about 100 million, have a passport. So there you can find information about the date when the tissue was collected, the amount of the stem cells, as well that they were thoroughly checked for common infection diseases.
And you keep records of all donor stem cells, because I know when I first came here, I was presented with the documentation showing the donor stem cells, like this was the patient, their blood type, this was a healthy donor. And you have all that information in case people want to know.
Yes, all necessary information you can find there according to European standards.
Okay, now let me see. How do stem cells work?
The basic effect of the stem cells is activation of regenerative capacity of the body. So if there's any kind of problem, damage, chronic disease onset, the stem cells are among first cells who are in that place and start to activate the cells which are near, and so they function more thoroughly and more actively. It's like a special trigger, for the body to have the second birth for tissues.
So basically they're repairing damaged cells.
Yes.
Yes, and if I'm not mistaken, stem cells are very smart.
Yes, when they are administered intravenous, they mostly concentrate with the bloodstream, they travel around the body, and they could hear, if I can say so, special signals from damaged areas. Those are special inflammatory markers which attract them mostly to these areas.
Okay, so the stem cells go to the parts of your body that need it the most.
Yeah, and
that's great.
Some of them can differentiate into the necessary cells, like the blood cells, or it can be muscles or heart, cell, in kidney, in liver, so those cells which should be restored. But their basic, probably most great effect is to activate the rest ones which are healthy to function properly. They as well activate the growth of new vessels. This is angiogenesis, a medical term, but it means new vessels appear, and it means better circulation of this area and better outcome, for inflammation or any pathological process.
Okay, now is it safe to to get stem cells?
Yes, it's quite safe. When we are talking about own stem cells therapy, it's clear. Yes, the body has the same genetic material, and there's no any kind of issue for any kind of concern, yes, about safety. When we speak about donors, stem cells, then we need to aware that these kind of cells are special. We can say they are immunoprivileged. It means that the immune system of recipient is friendly with them after their administration. They can't see this immune...
So basically you're saying like your body can't reject it.
Exactly.
So there's no chance of rejection of the stem cells. You don't have to take immunosuppressors after treatment because it will just integrate into your system.
Exactly, you're absolutely right.
Okay, now how would you administer the stem cells into my body? I already know because I'm a patient, but for the people that want to know.
There are many ways of administration. First of all, the most common one is IV, intravenous.
IV, which is basically what I have in my arm, and if you saw from previous videos, and it's a painless process because I just had it done an hour ago, and it's what, 30 to 40 minute process. Now, what are the other ways to administer the stem cells, doctor?
According to the disease and doctor's suggestions, it can be inhalation, done via inhalation.
So breathing, you can breathe them in, okay.
Yes, when patients can breathe them. It can be as well intra-articular, inside the joints, problematic joints. As you know, when people are getting older, very often they have problems with knees, with hips, even peripheral small joints can also have the dose of the stem cells to activate process of recovery there and reduce inflammation, improve mobility, yes, range of motions, which is a serious problem for adults.
Okay, now I know from personal experience that stem cell treatment treats hundreds of different diseases and illnesses, but if you could just give a brief summary of what you treated here at Swiss Medica in Moscow and its effectiveness on the diseases.
We have a great variety of diseases listed, and among them you can find neurological problems, and it can be stroke, multiple sclerosis, Parkinson, dementia, etc. Yes, these are most common.
And diabetes.
And yes, for endocrinological, of course, it is diabetes type 2. And
speaking from personal experience, type 2 diabetes was one of my illnesses when I first came to Swiss Medica over 2 years ago. And after my first stem cell infusion, my sugar levels dropped to normal. And to this day, 2 years later, I'm still not diabetic. My sugar levels have remained normal for over 2 years. So just for people to if they're curious, like, you know, do I have to go get stem cell treatment every week, every month, every year? It's not about that. It's your body's reaction, but you will see results usually after the first treatment.
Yes, usually it happens after, let's say, 1 month and a half, 2 months period till 6 months. This is a time frame when people can see the effect of the stem cells.
Yeah, speaking from my own personal experience, after it took about a month and I saw the results. You know, I mean, I was very impressed by that. I think I already explained this next question, but from the doctor's perspective, is it a painful procedure?
I should say, as anesthesiologist in my past, that it's absolutely painless procedure. It is done when we are talking about donor cells. You told it looks like ordinary drip, so there's no need for any kind of anesthetics. If it is a kind of procedure with own autologous stem cells, it is done under local anesthesia, and patients are without any negative feelings. But as a professional doctor, in case of necessity, some sedation can be added, for sure.
Okay. Let me see. And what is the duration of the treatment? Like, how long does it take?
The duration, if we are talking about the only stem cells therapy, during day, yes. The procedure lasts for 30-40 minutes. When the stem cells solution is ready, then it is done, and like ordinary one, it lasts for a short period of time. Of course, it is as well checking main parameters that can make the procedure longer, such as pulse rate, blood pressure, and personal feelings. After 3 minutes, it is done. Yeah. So small amount are administered, then it is checked, and so 3 times it should be like this with a short interval.
Now, speaking as a patient, I had my stem cell treatment a little over an hour ago, and I feel perfectly fine. And when you're getting your stem cell infusion, like I got my stem cell infusion intravenously through an IV drip. Now, it's not like you're not monitored. The stem cell doctor is right there while you're getting the infusion. And there's a nurse right there checking your temperature, checking your pulse, and asking, speaking to you, how do you feel, engaging you. So, you don't have to be afraid of the process. You're monitored completely, and it's a very safe procedure. Okay, now, what would you say your success rate is? Now, keep in mind, success rate varies from patient to patient and depending on the illness or the amount of different illnesses that they have. But what would you say your overall success rate for improving patients' health and quality of life would be?
If we are talking about your case, it worked quite well. Yeah, we can say it's about even 99% that your parameters, your A1C level, that says about 3 months level, yes, average level of glucose in your blood, it is almost within normal range, about 6, that is good. So with you, it is one result. Yes. If we take patient of your age and the same
and of course, symptoms, I'm 48 years old. Yeah. I'm not a young man. I'm 48 years old.
You're quite young, I should say. It also, depends on individual parameters, such as regenerative potential property of the body, because it can be different, really. Yeah. How long the disease lasted, if there are other chronic problems, because really it happens very often when patients come with several problems, such as multiple sclerosis plus endocrinological one, etc. So they can have better results with one disease, and less with another one.
Now, stem cell treatment obviously is successful in a varying amount of patients. Have you seen success in stem cell treatment for patients that were older than me? Because I'm 48 years old. Have you seen how old are the patients? What are the oldest patients that you've treated here?
I should say that the oldest patient which we had here in clinic was 94 years old.
Really?
Yes, it was a family from Saudi Arabia.
Whole family?
Yes, the whole family came for the treatment of their old mother. And they supported her. By the way, they stayed in the same room.
Yeah, for everybody watching, this is what they call a family room. So if when you come for stem cell treatment, you're allowed to bring a guest. And if you want to bring your family, if you're not comfortable coming by yourself, you make arrangements with the clinic and they'll put you in a family room that's got several beds, chairs, television. It's even got a refrigerator that's right off camera. Also, just on a side note, the clinic is immaculate. They keep it very clean. There's a house cleaning staff that's around all the time. They have a full kitchen staff, and it's an amazing facility. But I'm sorry, please continue.
And this lady had stroke plus dementia.
At 94 years old?
Yeah, okay. And they came to clinic to help as much as it is possible. And after the treatment with mesenchymal stromal stem cells, the activity of this lady increased. I can't say it increased insignificantly, but still...
but it's still increased.
Yeah.
At 94 years old, that's impressive.
Yeah, her cognitive functions such as memory, recognizing family members improved.
Okay.
So even relatives could say that she is more active, her mood improved, and the strength when she said hello like this, yeah, that it was, more muscle strength they could feel. They came to clinic after some time again to support that level which she had. So
Wow, that's impressive.
this is a
Now, I said it before that we're located in Moscow. Okay, now let me see. How long have you been at this location?
this location. The clinic exists for about 10 years.
10 years, based
Yeah.
out of Switzerland. Swiss Medica obviously is based out of Switzerland.
Yes.
But yes.
And now we have 2 branches here in Moscow and in Belgrade, Serbia,
Okay.
where the stem cells therapy can be done. And
So I can come to Moscow to get stem cell treatment or Belgrade.
yes,
Okay, that's excellent.
the same treatment you can have.
All right. I prefer Moscow. My last question. Now, I know for a fact that when you come here as a patient from Swiss Medica, you get a complete evaluation. There's multiple doctors with multiple specialties, and they evaluate all your testing, your heart test, your gastrointestinal, blood pressure. They monitor everything. And they customize a treatment program. Now, what people may not know is you do more than just stem cell treatment here, yes. So please elaborate on the treatment program and what other treatments you offer on top of the stem cells to create a more complete experience.
Well, before coming here, we need to have much information about the patient, and it's not only short, brief medical history, but as well it depends on the disease. We ask additionally for some tests. It can be MRI or biochemistry, etc. And sometimes we ask for neurological patients' videos to assess their activities, what they can do, and what neurological symptoms they have. And after that, we have doctors' expert advisory board, which assesses thoroughly the case, and then special individual treatment program is suggested for the patient with specific duration and treatment itself. It is combined therapy. For sure, on the first place, it is a stem cells therapy, but it also has so-called IMR treatment, intracellular metabolism recovery. It is a name for infusion therapy, which contains different substances. As you could observe it is complexes of amino acids, high doses of vitamins, etc. For each special case, it can be different medications.
Yeah, so basically, I'm coming here for stem cell treatment. I'm not just getting an infusion. I'm getting a huge portfolio of treatments customized specifically for me, and to better increase my health. And what I want to point out to the viewers is, even if you don't have all the testing that's required, Swiss Medica will get more testing done for you if they require it. Nice. Because when I first came to Swiss Medica 2 years ago, there were a couple of tests that I couldn't get, so I was actually sent to a local hospital to get them done. And what I would also like to point out is that Swiss Medica will accommodate you for all your conditions. Like me, currently, I'm on dialysis, for kidney disease. Kidney disease was one of the diseases I had. So what Swiss Medica did was they set up dialysis for me at an adjoining facility to accommodate my condition. So I can get my stem cell infusions and I can get my other treatment. Now, if you're worried about coming to Swiss Medica because you have other conditions that might prevent you from traveling because you have to go for treatments or something like that, all you need to do is speak to Swiss Medica, to speak to the administration, and they'll make arrangements if it's feasible, if it's possible. They will make arrangements for you. And I also want to point out that it's very safe to travel here. If you're having, if you're a little concerned, you have health concerns, It's very safe to try. I just traveled here from New York City to Moscow 4 days ago, and it's completely safe. It's a very clean facility, very hygienic, and I definitely recommend it. Okay, two last things that we're going to talk about with Dr. Alexandra are contraindication and source of stem cells. First, we're going to talk about contraindication, which basically means that you're not a candidate to receive stem cell treatment. And I'm going to let Dr. Alexandra elaborate on that, and then I'll interject a little bit. Doctor?
If patients inform that they have at the moment any kind of cancer, yeah, then we say, sorry, we can't help you, and this treatment it's better not to do, not with us or with any other clinic, because it can stimulate the growth of cancer itself.
Yeah.
So we will not help, but on the contrary, it will be negative effect on the body.
So basically what she's saying is, if you're a cancer patient, odds are you're not a good candidate for stem cell treatment, because stem cells, if you can remember from what I was saying before, stem cells have a tendency to repair damaged cells, they multiply cells. So if you have cancer, there is a good chance that stem cell treatment will just multiply your cancer cells and will increase the further progression of the cancer, which nobody wants. So unfortunately, if you currently have cancer, it's not the best treatment for you, and I don't recommend it. Secondly, we're going to talk about sources of stem cells. So if you can go into that, please.
Yes, for the stem cells, they can be different sources. First of all, it can be patient's tissue and such.
Patient's tissue. So where would you extract that from?
It is easier to extract, and the amount is sufficient from abdomen area.
From my abdomen, from my stomach, my belly.
Yes.
Okay.
And from bone marrow.
Bone
hip,
marrow.
area. Plus, sometimes it can be peripheral blood or ginger. It depends on the disease. Gum area.
Oh, okay, your gums. Okay.
Yeah. So for patients. And donors cells, or allergenic, sometimes we call them allergenic, it's a medical term. The source can be placenta, umbilical cord blood.
Okay, now for people who don't understand, obviously, where does the placenta and umbilical cord come from as going for the anatomy?
These types of cells can be collected when the child is born. So we are adults, and if our parents didn't store these cells, we can't have our own stem cells derived.
Okay. So placenta and umbilical cord are coming from birth?
Yes,
from the birth.
During the birth.
During the birth.
When the child is born and started to live separately without mother, there are tissues such as even placenta. It is called like an organ, which helped to connect mother and the child. Now this organ not important, yes, and the stem cells can be taken from placenta, from umbilical cord, and umbilical cord blood. These are three basic sources, which can be used after the child's birth.
Yeah, so these stem cells that are coming from the placenta and the umbilical cord, they're coming from healthy fetuses.
Sure.
And you also provide the paperwork on, the donor. Is that correct?
It's absolutely correct. It's a biological material, and special documents are with them. You can find, if patients have this procedure, they can learn this information, where in this passport mentioned the amount of the stem cells which they will have during the procedure, when the tissue was collected, and very important that it was thoroughly screened for common infection diseases, and viability, so how many cells are alive and effective. So all this information is there.
Okay, great. Let's see if is there anything else we need to cover? Well, then we got everything. Dr. Alexandra, I would like to thank you for your time. Once again, this is Joseph Jerez from New York City, coming to you from Swiss Medica in the Moscow, Russia branch. For any more information, you can get on their website, you can click on their link and fill out the information, and a doctor from Swiss Medical will contact you and let you know about a viable treatment program. Thank you for watching the video. Have a good day.
Have a
До
good day.
свидания.